We have got a mail. Hi doctor, I'm from Cotton. I have heard about IPIL. How effective is the IPIL and are there any side effects?
Well, so far we have been talking about the methods to prevent a pregnancy, and we all know that it's not a very perfect word and mistakes do happen. So it's always good to know about what methods we can use to actually correct this mistake. Now, an unplanned sexual intercourse can happen anytime, and if you know that there is a possibility of pregnancy, or maybe say a different scenario that you were using a contraceptive like the condom, but probably it's not worked properly, and you would like to have a second method to prevent a pregnancy, there should be something which you could use. Now, in IPIL, or it's one of those brands of emergency contraceptive tablets which is available in the market. Now, unlike other medications which need a prescription, this is a prescription-free medication. That means anybody can go to a pharmacist and actually ask for a medicine without a prescription from the doctor. Because we know that by the time you realize that there is a problem, you go and see a doctor and then get a medicine, it might be too late. Especially with IPIL, where the medicine works best when you are actually taking it as soon as the event has happened. That means you take it between, say, now and the next one day, it works very well. And the longer you wait after that, the chances of it working becomes less and less. But still, if you take it, say, up to 72 hours, that's 3 days after the event, you still have an 80% chance of it being effective. So it works quite well in most cases. So it's still better than having no method. But if you've crossed the 3-day period, that means you have crossed 72 hours, it might be a good option to go and see a doctor, because they could actually give you other methods which are not as easily available as this one, which might work. For example, a woman can have a copper tip put in up to 5 days after a sexual intercourse, which might actually prevent a pregnancy. Now, you also asked me about side effects. That's something which you have been asking very frequently. Now, the IPIL, or the emergency contraceptive pill, works by preventing ovulation, that is the release of the egg from the ovary, or by making the lining inside the womb unsuitable for a pregnancy to implant. That means a pregnancy doesn't hold on after that. Now, when this happens, it might actually sort of damage the rhythm in your body, and you might actually have a period which might be slightly later than the usual, or maybe a period which might be slightly irregular. And you know that if you have a delayed period, you would be always worried about a pregnancy, so which actually can cause a bit of anxiety. But nothing major, it won't cause a major medical problem. It's just those minor things which can actually worry you a bit more.